This underway. Okay. Terrific.
So I put together for this particular boot camp a discussion of dynamic models and data, the varied interfaces we have. How do these models sort of come together with data? I've talked about these models as sort of capturing theory. And that theory can be very powerful in and of itself. And often there's some so-called stylized models that I spoke of, which are designed to sort of think through the implications of the theory with rather less than the data side. But often a big need is to take these models and adapt them to context, to adapt them to Saskatchewan, or to adapt them to Moose Jaw, or to adapt them to the specifics of your health region or health jurisdiction of interest. So I'm going to be talking about the different ways that models do come together with data for this. And there are several specific ways we're going to be talking about the ways these models interface with data. Direct model parameterization, what we call backing out, or basically it's parameterization, which involves some derivation of parameter values, and then calibration, which is a process we may be covering in more detail on Thursday or Friday for those who are staying. And then we're going to talk about dynamic modeling in the presence of data limitations and what the needs and constraints are here, because we're often dealing with a situation where the model could use access to lots of types of data, but we don't have many of them. We're dealing with incomplete knowledge in many cases. Okay, one thing I don't have emphasized here is that models produce a great deal of data. They produce results, which we're often going to be inspecting or looking at. You'll recall for those models we've seen, there were those graphs, remember that, up at the top, which showed model results? I haven't covered that here. We may do so in a separate lecture. Okay, so let's talk, big picture, this first issue, interfaces between model on one hand and data on the other. Fundamentally, we have the need to bring into the model a set of data related to model parameters. So these reflect this sort of data deals with assumptions that we have that we need in the course of the model. So for that model we saw yesterday, and maybe I'll flash it up here, a model associated with, for example, this primary care paradox. We might have some sort of data associated with how frequently someone who's not ill becomes ill, or for a given disease, how frequently that disease goes into remission and so that it's going from a state where it's actually active to the point of remission. There might be data points associated with that we want to use within the model. And to do that, we typically talk about the parameters of the model. These parameters encode the model assumptions. And often we want to put in data for those assumptions. Now, there's some ways in which we do that directly by estimating these things. In some cases, we do it through calibration. We actually try to match the model results against empirical data. So we're going to be talking for the next bunch of minutes about this issue of parameter estimates. I notice I have some comments here on the data produced by the model. Suffice it to say that how many people here are familiar with regression models? Is that, yeah, okay. So with a regression model, you'll typically have a dependent variable and then a set of independent variables. And with a dynamic model, it's not that neat division. You may have model variables that are designed for output, but those model variables may also be contributing to how the model changes over time. So they're not purely reporting. They're actually it's almost as if the dependent variable is part of the independent variables as well. It's part of contributing to the results. So output variables here are not strictly only output. They may also be contributing to the system's behavior over time. And generally, we may have many such output variables in contrast to your most typical case in a regression. So if we have a model like this is a system dynamics model, for example, we might have certain values. If we're dealing with parameter estimation, this is parameter estimation, we might be dealing with a situation where we have, for example, obese individuals depicted, and then some stock which represents undiagnosed diabetics, pre-diabetics, and there might be a flow here associated with a certain chance per year that someone who's obese develops pre-diabetes. And that will be associated with a parameter value, some representation of that incidence rate. You know, there might be a 1% chance per year that someone is in a certain age category and obese becomes pre-diabetic. And they'd be initially undiagnosed pre-diabetic. So this would be an example of sort of one model structure where you might have a parameter that influences this part of the model. And that parameter would require some data. To run this model, we need to put something there for that parameter value. Maybe it's big, maybe it's small, but there needs to be some value in order to run this model. Just like in an Excel spreadsheet, you need to have some value in a cell for it to calculate the total of that cell plus others. There needs to be something there. And of course, we could examine the impact of making different assumptions here. It's no problem. But ultimately, this is one of the key points of interface between a model, a simulation model, and data. In order to run this model, to see how these stocks change over time, like we were seeing yesterday with that model of the hospital that Kurt had created, that system dynamics model, you need to plug in this parameter value. And within the context of these agent-based models, it's a very, very similar thing. So that very first model we examined, the crowding disparities model, if we went and looked at that, you may remember this from yesterday. For example, there's this issue of someone's in an infective state, how soon do they recover? And that assumption would be given by this sort of certain duration. And the value of this duration of infection, that value would be set as a parameter value. So where do those parameter values come from? Well, they typically come from a variety of sources. So when Kurt yesterday was talking about how he got values for his model from a variety of sources, that was through help by Jenny, Vlotka, and others in the health region, amongst other things, as well as in the Ministry of Health ED weights and patient flow team. They drew their data from a variety of sources. And the sources I've listed here aren't necessarily the ones that they drew on, but it's a common theme that when you have a model like this, you're looking for data from many places that will inform it, because the model includes many factors. Some of those factors might be demographic related. Some of the factors might be related to the natural history of concerns of interest, of the health concerns. Other of the factors might be related to your particular facility. Others related to care-seeking behavior in the province. These come from many places, and we won't just go to one data set. We won't just go to DADS or go to the CCHS or go to the covered population data for any one of them. Rather, we would draw different. We won't only go for that for all of them. Rather, for a given parameter, we'll draw it from a particular source. And so it's quite common in a model when we have these parameter values to draw some from surveillance data, some from data from outbreaks, perhaps, or from intervention outcome studies. We'll go to many different sources to draw on values for these parameters. And sometimes those sources, ladies and gentlemen, have been collected in different times or different subpopulations, and we have to be cautious of that fact. So when Kurt said yesterday that he plugged those values in, and or maybe he said it today, and they're inconsistent. They didn't seem to be consistent in their values. That may have been an indication because some of them were drawn from this particular set of hospitals and some from that, and they weren't consistent in the picture that they give. We thought they would be, but they weren't. So just be aware that often these models serve, and this is their strength, but it's also a vulnerability. They serve as kind of a single house under which data from many sources sits. We bring together all this evidence in one place in the form of a model. So the model links all this different evidence from different locations within a single structure. And that's very powerful because it allows us to synthesize that evidence to see its implications for our decision making. But it's also potential liability because some of that evidence may be higher quality. Some of that evidence may be from different contexts. We're not sure how much it applies here. And we need to navigate that uncertainty. We're going to be talking later in this week about ways we do that systematically through something called sensitivity analysis. But suffice it to say that when it comes to parameterizing the model, to getting values for quantities like this, or in an agent-based model like this parameter to govern this transition here, or to govern this hazard here of seeking care, we will often have to draw on different data sources. So to deal with this, and I just mentioned this, often there's some uncertainties associated with these values. Sometimes the uncertainties are broader, sometimes they're more narrow. And often to identify parameters that where we have to be really careful, we'll conduct what's called a sensitivity analysis. And in this case, what we do is we vary that parameter value and see how much of a difference it makes for model output. And particularly for our things related to our choices, the difference between intervention A and intervention B, how desirable an intervention is. This sensitivity analysis is supported by tools that we don't have time to go into today, but we will tomorrow or the next day. We'll actually run a little sensitivity analysis using a model to see how much of a difference this assumption makes versus this one. And this is a very, very important thing, because with these sorts of models, and this is a key point, with these sorts of models, nonlinear models, some uncertainties will be more important or more significant than others. This is an absolutely key fact. Suppose we have a model that has many parameters in it. We have many different things within this model that affect it, many different assumptions. It turns out that some of these assumptions may be associated with 100 times the sensitivity of others. So some of the assumptions really make a difference in terms of the things we care about, and others really come out in the wash. It's almost no difference. We could assume a broad set of values and we'll get the same result. This is a distinctive feature of this system. And this is why we say, that Francis Bacon quote, it's easier to evolve truth from error than from confusion. That won't be obvious until you build the model. When you build the model for the first time, then you can do the sensitivity analysis and you can say, okay, it's really sensitive to this one, very insensitive to that one. Let's put our efforts into collecting this one. Let's go and actually put down some money, pay the Ministry of Health to collect data on this. And that's what we've done in our modeling studies. We've created a model, we've studied it, and we say, okay, these are the key parameters. Let's put the time, effort, investments into getting good values for those. These other ones may be uncertainties, but they make almost no difference. A very pronounced feature of dynamic modeling. It makes a big difference which parameters you're talking about, and you get that insight by having some model to work with, even a very rough one. Okay? So when it comes to parameter estimation, the parameters are drawn from many sources, often, and the sensitivity to those parameters will vary dramatically, sometimes by orders of magnitude, depending on what parameter you're dealing with. Okay, so suppose you're dealing with a parameter that you think is decently important, or at least modestly important, but you don't have directly data on that parameter. For your context, you want to know the value of this parameter. What do you do? Well, there's many strategies employed. Sometimes you use data from a representative region. You say, well, we don't know that for Saskatoon Health region, but Regina Capel has that really good data. Thanks to folks like Liam and others, they've really taken the lead in terms of collecting data like this or that. Maybe we can try to use that data for now, put it into the model, and we'll try to test the sensitivity and see how big a difference it makes. If it's really important, we'll try to see if we could put some effort into collecting similar data here. That's one way of approaching it. But often, ladies and gentlemen, we can do better than that, because we may not have data on a given parameter by itself, but we'll often have data on patterns of the system, which we can use to constrain our understanding of what that data might be for that parameter. Okay? So we might not have data that can go into one specific parameter, but rather it's data that relates to the behavior of the model as a whole and to the system as a whole. And we may not be able to directly go from that to a parameter value, but we can experiment with values of the parameter value and best match, find the parameter value where the behavior of the model best matches the behavior we see in the world. Okay? So in other words, we adjust the value of that parameter to get the model's results, the model's output, the model's emergent behavior to match similar data in the world. Now, this sounds very abstract. This sounds very, very airy-fairy. Let's give an example here. So suppose I were to go to this very first model that we ran, and I were to go run it. Now, you'll notice there may be parameter values here concerning durations of infection, etc. Okay, I don't know what, sorry. Here's this model, and we're going to run this model. This model is a model for just for display here, but what I'm going to do is I'm going to go look up here at these patterns. And it may be that there are some parameters in this model we don't directly have, but it may be that those parameters really impact this graph up here to the upper left. And maybe we do have data related to this that we've collected related to, people's number of presentations at the clinic based on income is unlikely we'd be able to elicit. But we might have similar data for some of these that relate to case volumes by characteristics or what have you. And we might be able to match up the output of the model against similar empirical data and find what assumption about that less well-known parameter allows the model results to most closely match data from the world. Let me see if I can emphasize this point. It's not that we're saying we have data from the world that directly allows us to plug in a value for a parameter about this duration. Rather, we might be able to find that this duration parameter, when we change it, it really changes some of these results from the model, the types of patterns that are put out. And we could find a value for this parameter whereby the model results most closely match what we observe in the world. So we're trying to adjust model assumptions so that it most closely mirrors what we actually see in terms of the behavior of the system. So rather than going to the external world, finding the data point and plugging it in, we may not have recourse to that. Rather, we adjust our assumptions in the model so it stays most true to what we observe in the world in terms of these overall patterns. And often, ladies and gentlemen, what you'll find is that if you look at data that you have within the world, you may have data about many different factors over time, and that may actually exceed some of the data you have at the parameter level regarding specific parameters. So rather than just drawing data on parameters themselves, what you do is you take data you have from time series from the world, and you get the model to simultaneously match the different types of data you have. So these are, to be clear, these are not data about a parameter value in the model. These are data about how the system behaves, overall patterns you see from the system, and overall corresponding patterns from the model. And you are finding the assumptions about these less well-known parameter values so that the model's results best match what we see in the world. So this is an example from some end-stage renal disease modeling we did a number of years ago now. And what you'll see here is data we have from administrative data sources here in the province concerning diabetes prevalence, diabetes incidence, total population, end-stage renal disease prevalence and incidence, and death from recorded cases of type 2 diabetes. And the blue here represents the empirical data. By contrast, the red represents the corresponding output from the model as to sort of what the model thinks this should be doing over time. So we have data from the world over time from some baseline point. We have data from the model for that same period, and we're adjusting parameters so that the model's results best match what we see from the world. Does that make sense to you? So the model's outputting, so we have observations of the world, and we say, let's get the model to output those same things. What does it think those things should be? And then if we have a parameter that we don't know really well, we will try to find the value of the parameter where they all align. And the point is, ladies and gentlemen, I'll get to you in just a sec. The point is, often we have time series like this or data points on many things. We can't go directly from end-stage renal disease incidence. We can't go from a time series on that to directly, ask, okay, what's the chance of developing diabetes per year for someone who's obese? This results from a tangled set of things, and that's just one of them. So we can't go directly from this time series to a parameter value. But what we can do is we can find a value of that parameter by running the model many times. We can find a value of that parameter where the model best matches that empirical data. Make sense? Okay, that's the idea behind calibration. We'll talk a little bit more about this. But yeah, question? Yeah. Yeah. Sure. Mm-hmm. Yeah. Mm. But however, as it's not tested, maybe we have done better parameters, it will change, and then we will have a similar match how the Canadian would, react. In terms of if it's not tested, maybe that is irrelevant. Maybe it doesn't have any statistically significant effect on the population, and we don't know that because it's not tested. Is this? So I didn't catch all of the question, but as I understood, roughly the question is, if there's data related to parameter values from a very different context, for a different group of population, or for a different population group, to what degree could we take that data and use it within our own model for our context, which may be rather different? So to what degree could we use data from Germany, for example, to place it into our model here, or from Africa, or what have you? So suppose there was an efficacy trial for some vaccine in Africa. To what degree do we want to really plug that in to our model here? Well, the question the question I think here is, you have to be cautious in that, but the question would be, okay, what's the alternative here? Now, calibration provides an extra check, and this gets into this issue of model validation. We expect the model, in contrast to like your common case with a single, with a regression model for a single parameter, where you basically have one dependent variable and you're trying to match that. With calibration, you are trying to get the model to simultaneously account for, explain, match a variety of types of data. So you're trying to, it's actually a pretty stiff requirement that you need this model to simultaneously match this, match that, match all these different things. And we'll get to a process called cross-validation in just a minute, where there's an extra level of check. But here, we need the model to match these items. Now, you could put in that value for vaccine efficacy from Africa if there's no more representative value. If you don't have one from a population more similar to the Canadian one, you might try that value in there, but you might find that the model results that emerge are actually quite at variance with what you might have seen in the Canadian context already, if that's already been something that's been experienced. You might be pretty cautious about that value in terms of assuming it and then saying, okay, we're going to just base our projections or base our anticipated results, for an intervention based on this. If I were you, I would look a lot at whether that's a highly sensitive factor, and if so, you could vary the assumptions about that with a certain error bar around it and see how the model results, what sort of error bar there is around model results that result. Long-winded way. What I'm saying is that you could actually take that parameter value and conduct a sensitivity analysis so that instead of getting out one model result, what you get out is a band of results that say how high could it be, how low could it be. If we assume it's off by 50% in either direction, how much does that result in uncertainty about the outputs we care about? And sometimes you'll find it's a very narrow band, and sometimes you'll find it's a much broader band. And that would point you to vulnerability, right? How vulnerable we are to uncertainty about that value. So that's a very common type of need, is to be sort of guard yourself against uncertainty there. Okay, so the idea with calibration here, folks, is we may not have data on a particular parameter value, but we have data on lots of other things. So let's make use of that data by getting the model to match these other things. And there's two basic ways we go about this that I don't have time to go into in detail here. One is called backing out, and in this case, it's a very straightforward derivation to try to go from the data you have to figure out what the value must be for a parameter. And this is routinely done for certain types of simple situations. However, a more common situation is where we have to engage in what's called calibration, okay? And this involves triangulating from diverse data sources. So again, here we start with a set of data that we bring to bear, and we try to tune the values of parameters to best match the observed data. That's what I was just talking about. We're adjusting these uncertain parameter assumptions so that it matches what we observe. Now, to really do justice to this, I should mention this key point. We build these models. A central motivator for building these models is to examine counterfactual situations that have never been observed before, situations where we have a new intervention in place, where we have a new structure of the care system, where we have private MRIs. We're asking questions where we've never gone before. And we want to use a model to probe what would happen if we do this, if we do that. It's a very powerful use of models. But in order to get to that point where we have confidence in the model, we need to do some work. We don't want to just trust any old model to do that question. We want to test our model. We want to see, is it worthy of our confidence before we look into situations we've never seen before. Does that make sense? Before we go and we say, model, help me understand the impact of this new intervention. We want to know, is that model trustworthy? Is it worthy of our confidence? And in order to do that, what we typically do is we deal with periods where we do have data. And we see the degree to which the model we have accords with what data we do have before we look into counterfactual situations. So I talked earlier about models being tools to make sense of the evidence, to see the degree to which our understanding of the situation about how things work out there is consistent with the evidence. And to do that, we need to first look at evidence for periods where we know we have some data, some evidence about what was going on, and we see if the model accords with it. If we run the model for the most recent 10 years, does it give results that are consistent with what we've observed for those 10 years? Does that make sense? Okay. So typically, before we look forward into the unknown, we want to make sure it behaves well for the known, for where we have some evidence. We want to make sure it jives with that evidence. So before we examine counterfactuals, we try to observe periods where we do have data. And a key part of this, and this gets into this issue of calibration, is that, ladies and gentlemen, with this, in fact, this experiment here, where we had this model, one of the best ways to do it is to actually build the model, maybe calibrate it with a bunch of your data, but you actually take a bunch of your data and you put it aside. Now that sounds perverse. Why are you going to take evidence and put it aside? Why aren't you going to use it to build the model? Well, bear with me for a minute. Suppose you take some subset of your evidence. Maybe it's, certain types of time series, certain types of data, and you put them aside for now when building the model. You don't use them to build up the model assumptions. You don't use them in your calibration. Instead, you put them aside, and then once you've built the model, you've calibrated it, you get it to match all these things, then it's only then that you see how well it predicts this data you put aside. So I put aside maybe data related to, maybe I calibrate the model on the data that's all above there, and then I say, how well does it predict type 2 diabetes deaths? And see how well it predicts this data I didn't tell it about previously. In other words, to what degree does it have predictive validity? To what degree does it account for things that were not presupposed in building it? This is a strategy that's called cross-validation, and it's a best practice, cross-validation. So the idea here is that we're operating with a model built on a subset of the data, and then we test it against the remaining, test against all of the data, and see the degree to which it accords with that evidence. In this case, the model is being held up to a pretty high standard. It's being asked to produce things that it's never seen before, that in no ways were presupposed into it, no ways were built into it. And that's exactly then, if it passes that test adequately, that's what we'll do with it looking forward, of course. We'll be looking at counterfactuals where we didn't have any evidence about what will be going on, and we'll ask the model to anticipate it. So this cross-validation strategy is one that's a best practice. It is not always possible to do, but it's a really good strategy if you can do it to develop confidence in the model, that we're not fooling ourselves with the model. Does that make sense? We're basically asking the model to be held to task by a higher standard, by predicting things that we didn't tell it about. Yeah.
Okay, so that's what I want to sort of make sure that I'm on the right page.
Yeah.
It's sort of keeping a variable out.
Yeah.
And then testing the model and seeing if it's predictable.
That's right. It may be a variable. That's a common case, and we've done that before. Or it may be a period of time. And this is a very powerful thing. So you might say, we'll calibrate this model against data for everything up to the past 3 years, right? We'll use that data, that evidence, to sort of build the model, to sort of build it as we think, will adequately address the situation. Then you take the data from the last 3 years and you say, okay, how well did it do anticipating what was going to go on in those 3 years? And if it seems pretty solid for that, then you might take it to look forward. Then you might take it to ask what-if questions with greater confidence. So it's not always putting an entire variable aside, although often it is. It may be taking a whole type of variable. We don't give it these things, we give it those, we calibrate it to those, and then we show it these others. Or it may be just omitting certain times from the evidence we gave it in building it, and then we use it to predict the other, to fill in the blanks, to fill in these things and see if it does well. If it didn't, what was off? Now, there's some shortcomings to this. It's not a perfect strategy, but that can build confidence in a model. Now, it could be that it didn't match the past 3 years because there was something in there in the past 3 years that changed structurally. That now this component of the medical care system was handled differently, and so it throws it off there. But that's something that could go on going forward. So it's good at least we're alerted to, okay, there are those limitations with the model. The point is we need to develop some confidence in a model before we entrust it with looking forward. Does that make sense? Okay. Any questions about that point? It's a high-level point, as we only have time for, in this event. This calibration involves tuning these values of less well-known parameters to match observed data. And I don't have time to go into this in detail, but it does involve a rather extensive process. And the software that we've been using has within its capability very sophisticated calibration. So you can use it to kind of ask, okay, find me the values of these parameters such that the model output best matches all these different types of data. That's something that's supported by this software, and you'll find lectures by me online. Those who are here Thursday and Friday may hear a lecture on this subject in a little bit more detail. Okay, now let's deal with this issue though, which comes up with what if I don't have the data? I mean, this all sounds great. Models capturing theory, combined with data and get insight. But what if I don't have the data? What if the evidence is totally incomplete? What if the data is problematic? What if we just never collected it? What do I do then? Is there any use to modeling? Some people would say maybe that's when you most need to model, because you most need to sort of draw on consistent reasoning from theory. I'm not sure I agree with that, but I do believe that it doesn't rule out modeling. It just may change what you do with that modeling, how you use the model in your processes. Amongst other things, it may put a premium on trying to identify what data you should collect. So I'd like to turn this question around. What if I don't have the data? What if I do have the data? Okay, then what? Okay, let's think about this. So dynamic models, I've argued, are not merely data. They combine theory and data. And the theory is captured in the model structure, how the system works. Okay, and the model brings that together with data, hopefully based in large part on empirical observation. Okay, so just with that reflection, we have to realize that just like our thinking about the world, our understanding, our theory, models are not perfect. But more to the point, let's expand that notion of what I mean by imperfection. Okay, this must be using timing. There we go. Okay, so let's talk about things. Models, even the most rich model, if we spent a huge amount of time building an exquisite model of the healthcare system here in Saskatchewan. I would argue that as a predictive tool, as a tool for forecasting, it's going to still have limitations going forward. Why is that? Why do I say that? So suppose we had an exquisite model. It captured in amazing detail the care processes in Saskatoon and Moose Jaw and Prince Albert and Regina. It captured all these, how the hospitals there work in exceptional levels of detail and fidelity. I would argue that if you were to run that model forward for 10 years, and you were to look at admissions to those hospitals, or you were to look at discharges, or you were to look at the size of the waiting time and emerge, or you were to look at the status of ALC patients, there would still be some divergence from the real world. Why? Well, among other factors, folks, there are factors that are genuinely stochastic that we're not going to ask a model like that to capture. It may be the effects of a heat wave here in Saskatoon that is unexpected, or in Regina that drives quite a few extra elderly people to the hospital one day, right? You wouldn't expect the model to predict the weather, I would hope, 10 years from now. And it's possible by fluke, you do get a much larger set, or you get that ice storm, that occurs in the middle of commuting, and you get a much larger set of traffic fatalities or traffic injuries associated with that, people coming to emerge. And it will be a fool's errand for me to stand in front of you and say that model is going to be able to predict the future on a point-by-point basis down to the level of the number of patients in that emergency room for the next 10 years. I mean, that would be foolhardy. You would rightly laugh me out of this room. I mean, it's just not possible. And this is the key point with even the most perfect model, to be a realistic model, one that's not able to predict weather, one that's not able to predict, the exact patterns of traffic, what the city of Saskatoon will do in terms of its road policy, the commuting options that are associated with it. I mean, there's all these factors that are realistically going to be outside a model. And those will lead to stochastics, factors that are omitted from the model. But inevitably, models have approximations in them. They have to put in rough estimates for how the disposition decision is handled in the ER, exactly how beds will go back and forth in terms of pushing folks to different wards. And there's going to be some factors which are outside the model, whether it's climate change or aspects having to do with new regulations for things like e-cigarettes. We don't know what lies forward. And the model's not going to predict it for us. This is not a crystal ball, right? I think we're all in agreement with that. The model cannot be and will be bitterly disappointed if we look to it as a crystal ball. So it's inevitable. We have to square ourselves with the fact that we're not going to have a crystal ball. We're not going to have perfection in terms of model forecasts. Well, what good are models then? Well, they're plenty good. All the things I've been talking about, learning from the evidence, understanding impacts of different interventions, all those things are still at the table. It's just they're not crystal balls. Interventions, among other things, change things. So we expand the number of beds. Guess what? We expand the capacity, and it's possible that will expand, that will lower the waiting times, and more people will come to RUH as compared to going to St. Paul's for Emerge. We invest, and people respond to it, right? There's a feedback there. We go and invest in a new ALC strategy, and it has implications for the long-term care facility interface in terms of how many beds are available in long-term care. We change things in the world due to new policies, new regulations, new structuring of our relationships, better reporting, all these sorts of things. We put in place new technologies, and it changes things. Those evidence that we have gathered over the past 10 years is surely good for something. but it's limited in terms of its ability to guide us going forward. We're often going into new uncharted territory. And, if we look forward to the situation where we have new interventions in place, often a lot of the data that we've been counting on will start to be a little bit questionable. With the new technologies in place, new drugs for CHF, new technologies for quicker diagnosis, a lot of the patterns that we've seen over the past 5 years maybe look rather different 15 years from now, right? We're in a different world, and going forward, often it will be less the data we can count on in terms of many aspects of the system, and more the model structure, how it basically works. The data will be a little bit variable in terms of how long it takes to be diagnosed with a given thing and how many patients come in of this certain type. Often it's more the model structure that is going to stay more constant, maybe not totally constant. If we have private MRIs, maybe it will change some aspects of how the healthcare system will change that would have to be reflected in structure. But the model structure will be less variable than the data. So we have to recognize that going forward, there's going to be a lot of changes we can't anticipate, and it's going to change things. And in fact, interventions which we're examining are going to change what goes on going forward. So what if I don't have the data? What if I don't have the data on this particular data point? Well, look, we often still have strong evidence captured in the form of model structure. This model structure really constrains us. Again, I argued you could take the same model structure, put in all different parameter values, and you're still going to see certain regularities. The model structure tells you a lot. You can still gain deep insight as to how, certain assumptions shape possible futures, and interventions affect what is likely to play out, even without really good data on some items. You want to have some rough data at least, typically, but the point is you don't need perfection to get a lot of understanding from the model. You may find it's actually quite insensitive about these parameters, and putting in rough and ready values will let you gain a huge amount of insight that's fairly robust. And I'd like to elevate the key question here. Okay, yes, the model is imperfect. Yes, the model, you may regard the model as being very fallible. But what's the alternative? Winston Churchill once said about democracy, it's the worst of all forms of government except for everything else. And to a certain degree, ladies and gentlemen, I'm partial to that comment applying to modeling. That, look, if you're going to be trying to make decisions between different interventions, modeling is the worst of all alternatives except for everything else. I mean, what else are we going to do? Okay, you want to rely on your mental model to sort of guess which intervention is best? You want to kind of judge what you think's going to work on the seat of the pants? That's not going to be better, surely. The model at least brings all the evidence to bear, lets us do sensitivity analyses, lets us jointly reflect on it. If it's coming from our heads, it's not going to be any better, and probably it's going to be a lot more vulnerable, a lot more fallible. So, these models, they're going to be imperfect. They're going to be problematic. They're going to be incomplete. They're going to be limited. But what's the alternative? What is the alternative? And is that any better, is what I'd ask. Models at least will help us learn from that evidence, learn more quickly, deeply, effectively, and robustly, so that we can gain understanding over time. But a lot of the times, ladies and gentlemen, we're going to be determining our way into a future where we don't have direct data. It's all great to talk. So I do a lot of work in the machine learning area. I do a lot of work with statistical models, and that's central to a lot of our delivery of value. And I'm very enthusiastic about prospects there, particularly with the rise of computational statistics. And much of what we inform models with is drawn from that evidence. But we have to recognize that a lot of times we're not merely working with times data where we have evidence to bring to bear. We have, a lot of times we're looking at interventions that are counterfactual. We're going into a new world that we're shaping, that we're creating. We're expanding our hospitals and we don't know what the impact will be on the measured demand. We are changing how care is delivered, how interprofessional communication goes on. And we're going to need to grapple with the fact that the evidence that we have will take about those new situations will take time to collect. And models can help us a lot, not in terms of perfection, but in terms of grappling with that uncertainty and giving us some way to go forward while still serving as a place when we learn something new, we can put it into the model. So we're often operating in a new reality where we don't have good data. We have to come to terms, if we want to change things for the better, if we want to nudge things to be more effective, part of that is giving up our tight worries that we won't have data about it. It's about grappling with that uncertainty, and models are the least bad of the tools that I know to deal with that situation, to wonder about what will happen in this new world where we don't have data. We're going to be coming back in my next lecture to talk about these sort of models with statistical models. And it turns out statistical models, including machine learning models, have a huge place at the table, but they are subject to the fact they're dealing with observed associations observed through empirical data between A and B, where that requires observation of the situation. And if you're dealing with a situation which has never been seen before, you don't have that data to compute those associations, and the associations may be quite different. We'll see if we could weave that in with an actual interactive example. Okay? So when we're changing things with interventions, associations change. And using statistical models to look forward is much more problematic than a dynamic model, because a dynamic model encodes the posited causal structure, whereas the statistical model is based on the associations. And I say that as someone who applies them a lot and sees huge value for them. Okay, let's talk about models, though. You need to recognize that, particularly when it comes to areas where we don't have great data, there's been a lot of use of what are called stylized models. These are models where we're not trying to depict a particular context. We're not trying to depict Saskatoon City Hospital. We're not trying to depict the emergency department in Moose Jaw. Rather, we're seeking to learn from the model sort of about how emergency departments generally function as a general feature, about how a kind of caricature of them works, so that we can sharpen our instincts, sharpen our understanding, sharpen our sort of understanding about how these things work most effectively. We can sharpen our sense of kind of how those sort of systems operate in general. And we may do so with a model that's designed to really be very simple and foster learning, even as it abstracts away from any context. By contrast, there's a set of models, and Yuan's model that you'll be seeing in another hour or so is going to be one of these, which are very empirically grounded. They're tied in with a lot of data about a particular context. And you should recognize, if you go to the literature, you'll find some models over here and some models over here. Kurt Stange's model on primary care is over here. We're trying to bring it more to this kind of zone, where we tend to play a lot. Empirically grounded models where we get quantitative insights from it. These stylized models, you can get great ahas. Oh, I never realized that. Of course we shouldn't measure it with that. We should measure it with this other thing. Or, of course, if I want to change this certain thing, I should be looking at this part of the system, not this other part. Great for high-level reasoning, but it's a different use of modeling. Okay? And some of the example models in any logic you'll find over here, and some you'll find here. The teaching models I used are generally more along these lines. Our models that we publish on and share with others and that we build with partners are typically more up in this region. Here, evidence increases as you go to the right. Ease of learning from it, ease of using it, generally increases as you go to the left here. So here you're dealing with a lot of moving parts, and you need to spend more time experimenting with it to learn. On the left-hand side here, you're dealing with very few moving parts and greater capacity to quickly get to some aha about a simplified representation of the situation. So some of you, probably all of you, are familiar with Canadian political caricatures. Have you ever seen those caricatures of Brian Mulroney or Stephen Harper? They accentuate features of their face in ways that are sometimes unkind. You know what I mean? The big chins, the big noses. That's not an actual depiction of exactly what Stephen Harper looks like, but it captures some truth about sort of recognizable features of his face, and you recognize it, right? These are kind of caricature models, stylized models. They capture a few things in a very recognizable way so that we can reason about them, but they're not trying to depict exactly what Stephen Harper's face looks like. That's the province of the more the right side of this. Not to associate this with Stephen Harper, sorry. But this is more accurate depiction on the right-hand side that's very, very specific. On the left, we're dealing with kind of caricatures of models. So an example of a model like this that I'd like to show, which I won't ask you to follow through, but you're welcome to go experiment with, would be there's a model in here in AnyLogic. If you go to the example models, you'll find a model called the Schelling segregation model. Okay? And if we go down here on the right-hand side, there's a thing called Schelling segregation. So I went to Help, Example Models, and then I just scrolled down, and it's Schelling. And this is kind of a classic agent-based model that's designed for sort of stylized understanding. So this was created by Thomas Schelling. He was a sociologist who first did this work in the 1970s using a computer a model that was actually not a computer model. It was pennies on a checkerboard because he didn't have sophisticated computer models to draw on at that time. And the idea here is that we have a population depicted on some space, and each person is depicted as either being black or white. You could think of differences in religion or race or income. Each person is a single color here. And the idea here is to understand, he was interested in understanding how patterns of segregation emerge. And what you'll find as you run this model, the high-level insight from this is even small levels of preference on the part of a person about who to live with, that I slightly prefer to live with people kind of like me, can lead to very macroscopic patterns of something that looks kind of like segregation, where you have kind of black squares living with blacks, red with red. This kind of has a little bit of a similarity to the sort of groupings you see, and for example, his concern was with American cities. But he didn't make this. This does not depict New York. It doesn't depict Detroit. It doesn't depict Watts and LA. Rather, it's a depiction of kind of a general process to help us think through what's the implication. If we think through very simple preferences, I'd like to stick near people that are similar to me, and I'm slightly more likely, therefore, to move towards those people. What sort of patterns might we expect to see? And he found pronounced patterns based on this, and he found that the greater the strength of those preferences, the more and more pronounced, to a point where it's unable to find a sort of a stable situation. So in his model, this is kind of a thought piece model. It's a stylized model. It's not depicting how people actually make decisions. Rather, it's saying, if we have this situation, what are the implications in terms of these high-level features? The Schelling segregation model is kind of a classic example of an agent-based model that is stylized, and more on the left-hand side here. The model you'll be hearing in another hour and a half, Yuan's model, is more empirically grounded. Okay, so Stylized models aim to simulate high-level insight by sort of how a simple set of mechanisms can yield unexpected patterns or recognizable patterns and ways process assumption affect outcomes. And they abstract away from the vagaries of a particular situation to get high-level insight. I will tell you that Jeff here, Jeff McDonald, has a very interesting perspective on this type of spectrum. Jeff goes in the following way. He will typically put in place a simpler model early on, make it a very, very rich model, and then learn from that model, ladies and gentlemen, and create stylized models that capture that learning, that capture the essential truths he's gotten from that situation. He's been doing this in healthcare now for years. For decades, he's worked in applications of modeling to healthcare, and he tends to kind of go a little bit more like this, back and forth. Start with somewhat simpler models, make them really, really rich, learn from the evidence, have the evidence keep ourselves honest, and then move back to the stylized dimension to sort of communicate that high-level learning to others, including non-technical stakeholders. So stylized models, rich empirically grounded models. Most of what I've been talking about today, or in this particular lecture, has been about those seeking to build these. But don't forget that these can also be valuable, particularly where you have little data. You can think things through at a basic level, at this level, with comparatively low levels of data, sort of rough and ready values. Whereas here, you're going to be dealing on the right-hand side with needing to sweat the data values a little bit more. So suppose we have a model. We don't have good data. We'd like to do calibration, like to draw data from other circumstances in many cases. But suppose there are still values we don't have. What can we do about them? Well, remember that Francis Bacon quote, "It is easier to evolve truth from error than from confusion." One of the key insights, and I want to communicate this, I wish I had known about this about half a decade earlier when I started modeling. One of the key insights here, folks, is if you have that model and you plug in values that are roughly, you think, the right rough size, often you can spot from that model inconsistencies. This is kind of manual calibration. This is exactly what Kurt did. Kurt plugged in model data. Jenny looked at the results and said, that doesn't jibe with my understanding. Great. That's not a failure of the model. It's a success on the learning front. Because now, Kurt says, oh, okay, so this doesn't jibe with your understanding. Great. We didn't know that previously. Let's go and improve this part. Let's go and sharpen this data item. Let's go invest in getting better understanding about how this care process works. That wouldn't have been found if he had just sat back and said, well, we don't have the data, so we can't build the model. It's by building the model, by building something and getting it in front of people that those ahas occur, that those, you can present it to someone and they say, that doesn't match, this looks unrealistic, this thing looks pretty good, but this other thing is out to lunch, or we never see cycles like that. That gets you much further down the road than if you had just said, well, we don't know what the values are, so we can't build the model. Getting something out there, as they say, fail early, fail often. Learn, learn, learn. It's part of the learning loop that's also emphasized in lean processes and others, that continuous improvement, and you're not going to get there without venturing something. So that's a final comment related to modeling. I've covered a lot, and I can't do it in the detail that I'd love to because of time constraints. Any questions related to this? Yes?
When you talk about data and data, when you're building a model,
Yeah.
Is there an optimum amount or time frame of data? Like, is it a 5-year period? Is it a 10-year period? Is it like...
Oh, I see. It depends a lot. So it's a great question. So the question, as I understood it, is suppose you're building a model. What sort of time frame are you talking about for the data to be relevant that you might bring to bear? Is that
what's considered adequate?
Adequate amount of data? Yeah.
In research, there's a bare minimum sample size.
Yeah, that's right.
And power and that sort of thing. What is this in the modeling?
Yeah. In the modeling world, it will vary from model to model based on the needs of the model and certain features I'll now discuss. So there's not going to be a power calculation that you're going to do, and you're going to say we need, 30 data points to pin this model down to the necessary level of precision. We need to be confident in it. It turns out that power calculations in epidemiology and otherwise get really messy once you get into a complex situation. And, some of my colleagues who specialize in that sort of thing well recognize that, once you've got sufficient complexity, the easy calculations you do in class and for simple study designs start not to be very effective. And when it comes to modeling, it depends a lot on the particular model. So, in terms of kind of length of data of relevance, it depends. Like, we have some models whose goal in life, and there'll be one presented on Thursday or Friday, goal in life is to, sort of anticipate what goes on in a couple month period at most. It's actually focused, say, on an outbreak, H1N1 outbreak or what have you. And infection control at the span of over a couple months, prevention and control measures. And there, you're not going to be dealing with needing to draw on values of sort of parameters over the past half century typically, but there may be evidence that is viable for that concerning, say, recovery times or length of incubation period, which may have been derived 10 years ago, but which is still relevant now. So we could bring that to bear for sure. In other cases, we're dealing with models which are designed to look over decades. We're interested in cost for end-stage renal disease patients over the span of 50 years, something along those lines. That may seem awful long, 50 years. Well, why is that so important? Well, we're building dialysis facilities now that we'll be dealing with the folks who are merely diabetic now but may go on to end-stage renal disease 20 years from now. So there's actually a long inertia there. And over that time frame, there's a lot that could go on during that time frame, and the data that we bring to bear might actually go further back in time because we want to have the model account for the past few decades worth of data to have the confidence to look forward. So in terms of kind of time frames, models will often differ quite a bit in terms of their latitudes for drawing data from earlier. If you're dealing with a new emerging infectious disease, say MERS, you're going to have very limited ability to go back very far, right? And that's okay. With respect to volume of data, the reality here is that, folks, models, stylized models you can create for many situations to help us think through the situation. But generally, if you don't have quite a bit of evidence to bring to bear, and I know you'd like to hear a lot more about what quite a bit is, but the fundamental thing is you're not going to be able to build these models on the right here without a fair bit of evidence that's going to pin down parameter values of relevance. And so the scope of your model here is going to be somewhat informed by sort of the level of understanding you have at the level of what you're hoping to put into this model. So if you have very little data about how individuals progress with respect to the conditions of interest, you may go in a much higher level model of that side of it, which doesn't need nearly as much data. On the other hand, if you have lots of information to bring to bear, you may want a more detailed model, but you won't build it immediately. That's the thing. You'll often start with a simpler model and elaborate as you learn what's sensitive, what it's sensitive to, as you learn where your priorities are by experimenting with the model. Generally speaking, you don't want to build a model starting out of the gate. You say, okay, 2 years from now, we're going to have a great model. A great model. It's going to have all these features in it. We have the data to make it happen. You could say that, but it's going to be a big mistake. Why? Because you've missed the opportunity to learn along the way. First of all, it may not be 2 years, it may be 4 years till you have that data, and the government's changed in the meantime, and it gets canceled or whatever. But secondly, and more importantly, you want those opportunities to learn along the way, and you want to be producing product along the way. You want to be producing value. And the way to do that is to build it up step by step in a prioritized fashion. First we have this, then we have that, and that's exactly what the modeling that Jenny and Jeff and we have been doing, for example, with the patient flow, the emergency waste and patient flow. We started with a subset of the system, and you add pieces on, and you learn from what you have. You learn about the system, you learn about what's needed, you learn about what looks more reliable in terms of evidence, but you're also adding pieces on over time that deal with successive layers of issues. And that means that at any one time you have something to show for it, but you've also learned what it's sensitive to, so what data we really need to get. Because this is a key thing in response to your question. It's not a matter of total volume of data you want. You want the data that matters the most for the model. And as I say, you may have 90% of the things in the model don't really matter that much in terms of the behavior you're seeing. But that 10% you want to nail. And that's what's motivated us, for example, to put in, to pay through the nose for data requests to Sask Health to get us the data, the key data that will let us derive this parameter, for example, for the model. Because we know that one parameter has a huge impact on the outcomes. And so we're willing to put down the money, to put down the time. It's been about 4.5 years until we got the data, to get that data item. That one data item is worth it. And I have no regrets about that. So that's what a model will let you do, but you won't be able to do that until you have something in place, some rough model that you can do the sensitivity analyses. Is that helpful?
Yeah.
Okay. So, I'd be cautious about saying how much data you want, the volume. I'd be more about, which data do you want, and going deep on that one. Other questions? Great questions. Yeah.
We were talking a lot about the parameters.
Yeah.
But is there a way for us to choose the different types of distribution? We know when patients come,
Yep.
it follows different types of...
Absolutely. And those who are here, are you going to be here through Friday? Oh, okay. Okay. Those who are here through Friday will see some of this, where you can draw these values from. So we could draw. It's a great question. And the question was basically, as I understood it, okay, you might have a parameter value for a model, but what I was talking about seemed to implicitly imply that you want one value for that parameter. Could you have different values for different people in the system? For example, different patients presenting for care. Maybe there are different CTAS levels. Maybe they have different levels of comorbid symptoms that they have to deal with. Maybe they are different in terms of their age distribution, frailty, set a variety of factors, right, that each person might be different. Could you draw it from a distribution? Absolutely, and that's a central part of the toolkit. And it's actually very easy to do in the package that we're using. And in fact, that model that I first showed you, do you remember that model yesterday? If you go to that, you'll find people's incomes are drawn from a log normal distribution, for example. And you'll find that in many of the other models, we'll draw someone's, immune strength from a distribution or their age or what have you. So that's a central part of the need. And conversely, you could run the model many times. If you're uncertain about a parameter value and you want to see, maybe there's a parameter that has a single value, but you're not sure what it is. You can run the model drawing that value from a distribution and see what it implies in terms of the uncertainty on the output. The induced distribution in terms of outputs you care about, including how much better this intervention is from that one. So you can get out distributions on those differences. Great question. Did that address most of your question? Okay. Other questions? Okay. So we're next going to be talking about models and dynamic models and statistical models. but I figure we should have at least a couple-minute break for people to get up and so on. This is intense stuff, I know. Maybe you want to get a bit of coffee, a bit of food, and we'll come back and finish that up. And then we're going to go see Yuan's model over lunch. We're going to see the model Yuan has been building on patient flow and emergency waits through the province. Good. Thanks. Yes.